Welcome back, everyone. Back another spot for EyeOnVision with Dr. Mehta's joining us again, and this time, very important, diabetic eye disease.
Yes.
My number one question, does that only affect a person if they have diabetes?
So first of all, thanks for having me
Yes,
again. So yeah, it typically affects patients with diabetic disease. So type 2, type 1 diabetes, both patients are affected by diabetic retinopathy. And if you look at the prevalence of diabetes, you're looking at about 10% of the U.S. population that is currently diagnosed. Yeah. And if you look at patients over the age of 65, that number goes up to 26%. So it's a significant cause of morbidity and mortality in the U.S. and certainly a significant cause of eye loss, or I'm sorry, vision loss. Vision loss.
Now, if you think if you have diabetes, should you go to your eye doctor more frequently than someone who doesn't?
It's a good question. The answer is yes. I mean, typically a patient with diabetes needs an annual dilated pupillary examination to look in the back of the eye, specifically at the retina. The retina, and specifically retinopathy, is the most common cause of vision loss in people with diabetes. Other causes include advancing cataract, but diabetic retinopathy is really the most important cause of vision loss, and it's unfortunately a little bit too common.
Yeah. And how does it affect your vision? Like if you were having a certain problem, do you think, wow, I have to have this checked out? Or
yeah, so basically, if you have diabetes and you're starting to notice a sudden change in vision, it could mean that you're having some leakage of fluid into the retina, or you can be bleeding into the retina or the vitreous gel, which lies in front of the retina. And basically what diabetes does is that the excess blood sugar can cause damage to the retinal blood vessels in the back of the eye. Those damaged blood vessels then leak fluid and blood into areas that the fluid and blood shouldn't be in.
Is it painful?
It's not painful at all. It's completely painless loss of vision, and it can affect one or both eyes, so it doesn't necessarily have to affect just one eye.
Okay, that's good to know.
Yeah.
And how do you treat it? How do we treat it?
So that's a good question. So we actually have multiple ways to treat diabetic retinopathy. We can use things like lasers to get those bad blood vessels to stop leaking. We can do things like anti-VEGF or intravitreal injections into the eye. We talked a little bit about that last month with macular degeneration. We can actually use the same types of treatments for diabetes, and they work just as well.
Oh,
and then finally, if you bleed a lot to the point where it's obscuring the vision, there's a procedure called a vitrectomy to remove the vitreous gel in the back of the eye. It's an outpatient procedure, and it gets rid of the bleeding in the back of the eye, and at the same time we can provide laser to prevent future bleeding from occurring.
So technology is really helpful in these types of diseases.
Without a doubt. Yeah, and we're getting better and better every single year. The technology is getting pretty incredible.
Wow.
We can do these vitrectomy surgeries as an outpatient surgery, small gauge, which basically means no stitches. And that's very comfortable for patients during surgery and after surgery. So a lot of the things that we do, the injections, the lasers, we can do without any pain at all, keep patients very comfortable, and help to stabilize vision for the long term.
Okay, sounds good. Boy. So risk factors, if you're in a risk group, of course, if you have diabetes, and if you're older?
Yes, and diabetes and old age actually go hand in hand. Type 2 diabetes is more common in people over the age of 50, and even more common over the age of 65. So it affects quite a few people here in Lake Havasu, and we're here for you guys if you need us.
Okay, great. Thank you, Dr. Mehta. Okay, diabetic eye disease. First, number one, see your regular doctor and get your diabetes in control, right?
That is correct.
Okay.
Make sure you see your primary care doc, and then if they want you to come see us, we'll be happy to take a look anytime.
Thanks a lot. Okay, we'll see you next month with EyeOnVision. Thank you.
Thank you.